So we've all heard the term growing pains, right? But did you know that they're real? They're a physical condition and actually more common than you may think.
Yeah, as many as 40% of kids can experience the pain that can be difficult to pinpoint and treat. NBC5's Lauren Petty has the information parents need to know.
You've probably heard of growing pains, but 11-year-old Cole Henninger has felt them.
Legs and the inner parts, and then like you can get down towards the knees and like a little painful there.
Just being uncomfortable, but it's not consistent. It's not every night.
Up into 1 in 5 kids can have growing pains. And so we know it's a real thing, and we know it affects a lot of kids.
Dr. Jeremy Alland says growing pains, common between ages 3 and 13, aren't coming from bones or joints, but are believed to be a muscular issue.
It's usually in the lower extremities, like in the legs. It's usually mostly at night, honestly. It'll oftentimes wake kids up. They'll have lots of pain.
The one catch with growing pains is they can be hard to diagnose.
We need to rule out everything else to make sure it actually is growing pains, because, like I said before, there's no test for growing pains.
Sarah Henninger's other sons have had growth plate pain, which is actually a separate issue often lumped into growing pains. Cole's discomfort has left her, like so many other parents, wondering what to do.
Simple massage, especially the areas that are bothering the kids. Heat tends to work pretty well. Ibuprofen, Tylenol tends to work pretty well.
Despite the aches, the 5th grade athlete isn't in a hurry to stop growing.
Who doesn't want to play basketball, be 6'7"?
But time will help.
Well, there is a cure, getting older.
In Wheaton, Lauren Petty, NBC5 News.
Now, doctors say growing pains are often associated with both legs. If only one side is hurting and there is any redness or swelling, that could be a different issue and should be checked out by a doctor.